So you're trying to navigate all the complexities of healthcare, right? And you want to understand what really signals quality and safety. Maybe you need to get up to speed pretty quickly.
Yeah, it can be a lot.
Well, today we're going to try and cut through some of that noise. This is our deep dive into healthcare accreditation. We're focusing specifically on Joint Commission International JCI and also the National Accreditation Board for Hospitals and Healthcare Providers. That's NABH.
Exactly. And we've pulled together information from, well, their official websites, obviously, but also from consultancies that help with accreditation, insights from ISQA, the International Society for Quality in Healthcare. And, we even looked back at our own previous chat about quality indicators.
Right.
So the mission here really is to grasp the core ideas driving quality and safety for both JCI and NABH, see where they overlap and where their approaches might differ a bit.
Okay, sounds good. Let's start with JCI then. When you hear about global healthcare standards, JCI definitely comes up a lot. Why is their approach so widely, recognized?
Well, I think what's really interesting is their fundamental goal. They state it as enabling and affirming the highest standards, highest levels, really, of healthcare quality and patient safety for everyone.
Okay. Universal standard.
Yeah, and their reach is genuinely global. They're working in over 70 countries across all sorts of different regions, and the sheer number of programs they accredit and certify, over 1,000, it just shows the scale of their influence.
Wow, okay. But it's not just about being international, is it? What are these highest standards actually based on? Where do they come from?
That's a really important question. JCI standards aren't just plucked out of thin air. They're really built on collaboration.
Collaboration? With who?
With healthcare organizations all over the world, with experts in various fields, and they draw heavily on the latest scientific literature, the evidence. This whole process aims to make sure their standards aren't just like aspirational wish lists.
Right.
But that they're practical, clear, achievable, and this is critical, measurable in all sorts of different healthcare settings.
Measurable standards. Okay, that makes sense. So how does a hospital or clinic actually show they meet these pretty rigorous standards to get JCI accredited? What's that evaluation like?
It's a pretty thorough evaluation process. It really focuses on tangible improvements in how the organization works, both clinically and operationally.
Okay.
They look at whether the staff have the right competencies, the right skills, and if the processes are really designed to reduce variability in care and, crucially, minimize risks to patient safety.
And when they're doing this evaluation, are there specific things they zoom in on? What are some of the sort of key pillars of JCI's approach?
Oh, definitely. A real cornerstone is their International Patient Safety Goals, the IPSGs.
Ah, yes, the IPSGs.
Exactly. These target really critical areas where things often go wrong in healthcare, like making sure you identify the right patient, communication between teams being effective, and ensuring surgery is as safe as possible. Yeah. So beyond the IPSGs, there's the main accreditation program itself, which is that comprehensive assessment we talked about. And JCI also offers specific quality management programs. These are designed to help organizations build up their quality systems and get ready for the actual survey.
You hear a lot about high reliability in healthcare now. How does JCI fit into that? How do they help organizations achieve it?
Yeah, that's a big focus. It connects right back to that goal of consistently safe, high-quality care. JCI provides a framework, really, to help organizations become more reliable.
How so?
Well, it involves things like fostering a really strong commitment from leadership towards safety, building a culture where safety is just part of how everyone thinks and works, and also implementing what they call robust process improvement, or RPI.
Or PI.
Yeah, robust process improvement. It's basically using data and structured methods to find weaknesses in processes and fix them before they cause harm.
So getting accredited isn't just like a one-and-done thing. It's more of an ongoing journey.
It's exactly right. Continuous improvement is absolutely baked into the JCI philosophy. They really stress that organizations need to be constantly looking for ways to get better to enhance performance.
And do they help with that?
They do. They offer quite a range of expert resources and tools, things like training, educational materials, even advisory services to help organizations keep improving.
Okay, so let's think about a hospital deciding whether to go for JCI accreditation. It sounds like a huge amount of effort. What are the real tangible benefits they get, beyond just the certificate on the wall?
Oh, the advantages are pretty significant. First and foremost, you generally see demonstrable improvements in patient safety and less patient harm.
Which is the main goal, really.
Absolutely.
Yeah.
And that naturally leads to higher quality care overall and better outcomes for patients. And when that happens, patient satisfaction and trust usually go up too.
Makes sense.
Plus, organizations often find it helps them attract and keep good staff, skilled healthcare professionals want to work in quality environments. It can also give them a competitive advantage in their market, and it definitely helps build the community's confidence in the care they provide.
Are they keeping up with the times? Any sort of new things coming out of JCI recently that reflect how healthcare is changing?
Yeah, they seem to be adapting constantly. They've launched something called JCI Continuous, which is a new model really emphasizing those ongoing improvement efforts, not just survey prep.
Okay.
And their partnership with the Geneva Sustainability Center on a healthcare sustainability certification. That really highlights the growing focus on environmental responsibility in healthcare.
Interesting.
They've also got a new laboratory accreditation program that actually combines the ISO 5189 standards with their own patient-focused requirements. And looking ahead, they've got a big event, Unified 2025, planned for Washington, D.C., focused on tackling key healthcare challenges together.
So definitely evolving. And we actually have a quote here from Roxana Fulton, a quality manager at Corniche Hospital. She calls JCI the standard-setting accrediting body in healthcare worldwide. That really underlines its global standing, doesn't it?
It absolutely does.
Yeah.
So that gives us a good picture of JCI. Now, maybe we should shift gears and look at how quality is driven within India, specifically through NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Right, NABH. So they're the main accreditation body within India.
That's right. NABH is part of the Quality Council of India. It was specifically set up to create and run accreditation programs for healthcare organizations across India. Their main aim is really to lift the quality of healthcare services right across the country.
Okay, and what makes NABH accreditation distinct? What are some of their key focus areas?
Well, one interesting aspect is their detailed attention to infrastructure. That includes pushing for things like IT-enabled patient management systems and even telemedicine, recognizing how important technology is now in delivering care.
Right, the tech side. And like JCI, NABH uses quality indicators too, right? We talked about those in a previous deep dive. What kind of indicators do they track?
Yes, quality indicators are absolutely central for NABH too. They generally group them into four main buckets. You've got clinical indicators.
Like outcomes.
Exactly. Things like mortality rates for certain conditions or tracking surgical site infections, for example. Then there are patient safety indicators measuring things like falls or medication errors.
Okay.
Third is patient experience indicators, focusing on communication, getting patient feedback, overall satisfaction, how patients actually feel about their care. And finally, operational efficiency indicators. These look at how smoothly the hospital runs things like patient flow, how long people have to wait.
So getting NABH accredited isn't just ticking boxes. Hospitals have to actively track these things and show they're actually improving based on that data.
Precisely. It's about hitting certain benchmarks, yes, but also demonstrating an ongoing commitment to getting better. And it's worth mentioning, quite a number of hospitals in India are already NABH accredited, and many, many more are in the pipeline. It shows a real drive towards quality improvement there.
You mentioned their focus on IT earlier. How does NABH specifically approach things like hospital information systems or HIS?
They provide a pretty structured approach for implementing HIS. They really emphasize how these systems can directly contribute to better patient safety, make operations more efficient, and ultimately support delivering higher quality care. You definitely see tech as a key tool for quality.
Okay, so we have JCI with its global reach and NABH tailored specifically for India. How do they stack up against each other? What are the main differences and maybe the overlaps?
Well, the most obvious difference is definitely the geography, like you said. NABH is India-centric, JCI is international. And because of that global perspective, JCI's requirements might sometimes push Indian hospitals aiming for it towards perhaps slightly different or additional global benchmarks.
Okay. What about scope?
Both cover a really broad range of quality aspects, from patient care to management. Where you might see a subtle difference in emphasis is maybe JCI placing a slightly stronger focus on more advanced data analytics and reporting within their continuous improvement models. And naturally, NABH standards are adapted specifically for the Indian healthcare landscape, considering local factors, whereas JCI uses a more universal set of standards designed to work across different countries and systems.
But the core goal is the same.
Absolutely. At the end of the day, both are fundamentally trying to improve healthcare quality and patient safety. and they both use quality indicators as a foundational tool to achieve that.
That clarifies things nicely. Okay, let's switch gears again and think about the practical side. For a hospital actually going through this, what's that process like? What's involved?
Yeah, it can be daunting. And this is where organizations, consultancies often step in. Companies like Supremediq, for instance, offer support to hospitals through basically every stage of getting accredited, including specific help with NABH.
What kind of support do they offer?
It can be really comprehensive. Everything from the initial planning and even design of the hospital through to recruiting staff and actually implementing the quality management systems needed for NABH or even NABL for labs.
So, what's the real advantage for a hospital using a consultancy like that? Why not just do it themselves?
Well, there are a few key benefits. These consultancies bring a lot of expertise and, crucially, experience with the whole process. They know the pitfalls.
Right, they've seen it before.
Exactly. Which can end up saving the hospital a lot of time and potentially money. They also help make sure all the regulatory boxes are ticked. And it often goes beyond just accreditation. They might help with ongoing operations management, like writing standard operating procedures or analyzing patient flow.
So they can really streamline what sounds like a pretty complex job. And we've got some feedback from hospitals that have actually done it. Hong Kong Adventist hospitals mentioned that their JCI process was actually a great team-building exercise. It improved coordination, communication. That's an interesting side benefit.
It really is. It forces departments to talk to each other.
Mhm.
And Shiji Kurian from Burjil Farah Hospital pointed out the competitive edge they gained from JCI reaccreditation, plus how it boosted community trust.
Right.
And similarly, Imad Sadek at Emirates Specialty Hospital talked about how that JCI Gold Seal really adds value and makes patients feel more confident in the care they're getting.
Yeah, those firsthand accounts really drive home the value we've been discussing, don't they?
You certainly do.
Okay, so we've talked JCI, we've talked NABH, the ones doing the accrediting, but there's another player here, ISQA, the International Society for Quality in Healthcare. They seem to have a bigger picture role.
That's a good way to put it. ISQA is a global, member-based, not-for-profit organization. Their whole mission is about promoting quality improvement in healthcare everywhere.
How do they do that?
They've been around for over 30 years, working to improve quality and safety through things like education, knowledge sharing. They actually do external evaluations of accreditation bodies themselves.
So they accredit the accreditors, in a way.
In a sense, yes, through their IEA program.
Right.
They also support health systems directly, and their network is huge, spanning over 70 countries, just like JCI's reach.
So they're really focused on improving the systems that lead to quality.
Exactly. And they strongly emphasize partnership with patients, involving them in their work. They also produce a lot of valuable resources. They have journals like the IJQHC and IJCOMS and various papers on patient safety.
Okay.
And interestingly, just to show how connected this world is, Dr. Surtaram Vishnoi from Supremediq, the consultancy we mentioned, he's actually an ex-fellow of ISQA.
Okay, so the expertise overlaps.
It does. And ISQA also holds major international conferences. Their next big one is in São Paulo, Brazil, focusing on inclusive health systems and using technology alongside humanity.
It really does show that this push for quality is a global effort. Okay, as we start to wrap up this deep dive, what are the main things we should take away about JCI and NABH?
I think the core message is that both JCI and NABH are incredibly important organizations. They're both driving improvements in healthcare quality and safety. The key difference is focus NABH primarily within India, JCI operating on that global stage.
Right.
But fundamentally, quality indicators are central to how both of them work, providing that framework for continuous improvement. And ultimately, getting accredited by either body brings real benefits for patients, obviously through safer, better care, but also for the healthcare professionals working there and for the organizations themselves in terms of trust and reputation.
So for you listening, as you navigate healthcare choices or just try to understand the system better, knowing about these frameworks, JCI, NABH gives you really valuable context. Recognizing their different angles but shared goal of quality can help you make more informed decisions and maybe appreciate the immense effort that goes into providing quality care. And of course, you can always dig deeper on their official websites.
Absolutely. It's been really useful to break down these two major players in the quality space.
Well, thank you for joining us for this deep dive into healthcare accreditation. We really hope this discussion has given you a clear picture, a solid understanding of why quality and safety standards matter so much in healthcare and sort of the different ways they're approached.
Yeah, hopefully it provides a good foundation.
Think about how these standards ripple outwards, affecting patient care every day, and maybe even shaping the future of how healthcare is delivered. We feel this information gives you a strong starting point for your own thinking and learning in this really critical area.